Okay, name.
Andrew.
Riley.
Ted.
Brandon.
And Theo. And I'm Garrett.
And I'm Becky, and I'm going to talk to you guys a little bit about how I do part of my job every day in the emergency room, which is start IVs on my patients that I take care of. These are done usually several times a day and on multiple patients. At times it must be done very quickly, emergently, while you're multitasking, and a lot of times we start more than one IV on critical patients. IVs are necessary for blood draws, to give IV fluids and medications, and for hydration sometimes, and all of this is done to benefit and care for the patient. So by the end of this presentation, I would like you to recall some of the steps an ER nurse must do in starting an IV, and some of the reasons for IV placement in the ER. As I said, patients need IVs for blood draws, medications, and fluids sometimes. First part of this step that nurses must do is perform hand hygiene or wash your hands. The steps are gather your supplies. There's lots of things we need to do this task. The IV catheter, tourniquet, gloves, skin prep items, lab tubes, needleless connector or tubing, the normal saline flush syringes for the blood draw, and dressing and tape to secure it once you're done. Then again, wash your hands, do your hand hygiene, and we always want to explain the procedure to the patient. Choose your site. Most done in the ER will be in the antecubital area, which is the area inside the elbow. Those veins are usually a little bit larger, and we can get better blood flow through those, and put larger IV catheters in there. So then you'll position the patient's arm, cleanse the area with the alcohol wipes or Chlorapep, and like I said, we have to choose our site wisely. A lot of times you can only feel the vein, you can't really see it. So then once you have all that done, you do your needle stick, assess for blood return, reposition that IV catheter if you need to. You want to get blood back because that means it's in the vein. And then once you do that, we'll draw some blood for all the lab tubes that we need to fill. And then you have to transfer the blood from the syringes into the tubes and make sure the tubes are labeled properly, because if we send blood to the lab and it's got the wrong patient's name or sticker on it, then we have to redo the whole thing. Then we secure the site with a dressing and tape. We use those normal saline flushes to flush through and make sure that it doesn't infiltrate, which that means that the fluid is not going into the vein, it's going like underneath the skin, and that can cause a whole lot of problems. So if that happens, we have to take it out and start it over. And then you'll give your medications or fluids that you need to give, check with the patient, make sure they're comfortable, they need anything, and then clean up your area, dispose of used items, and the sharps always go in the sharps containers. And then wash, use hand sanitizer again, of course. And this is a picture of what can happen if that IV does infiltrate. It can cause infection and be costly to the patient, and of course therefore the hospital and healthcare system. So you always have to monitor the IVs and make sure that they're infusing and not going into the skin. So as I close here, just some reminders that IV starts are one of the most frequent procedures that nurses do in the emergency room. It takes practice and experience and often has to be done quickly. It's an important part of patient care in the ER, and it has to be done with proper aseptic technique, meaning it's not a sterile procedure, but it does have to be clean. You need to wear gloves and clean the area and things like that. It's necessary for drawing blood, administering medications and or IV fluids. can often be scary for patients, especially like if you're doing it on kids. But we want to be confident in our skills and reassuring to them always. Most people don't want to get stuck with the needle, myself included, so we want to do it right the first time if we can, and avoid additional needle sticks. And with proper care and monitoring, it will benefit the patient, which is what we all want.